Impetigo, a common bacterial skin infection, mostly affects young kids. It's really contagious. So what are the main symptoms?
Itchy sores and blisters are common, yeah. These often burst, leaving these honey-colored crusts, and it can spread like wildfire.
Right. How is it diagnosed?
A doctor will look at the sores. They might also do a skin culture to see what kind of bacteria it is.
Okay. What's the usual treatment?
Usually they prescribe antibiotics, either a cream or pills. How long you take them is really important to prevent problems and stop it from spreading.
Okay, let's talk about the different types of impetigo.
There's non-bullous, bullous, and ecthyma. Non-bullous is the most common one. You get small sores. Bullous has bigger blisters filled with fluid. And ecthyma, that's a more serious one. It goes deeper into the skin.
I see. What age groups usually get each type?
Non-bullous is common in kids aged 2 to 5. Bullous is more often in babies under 2. Ecthyma can happen if impetigo isn't treated.
Right. Are there any spots on the body where these types are more likely to show up?
Non-bullous often starts around the mouth and nose. Bullous can be anywhere. Ecthyma usually develops from existing impetigo.
So what causes impetigo?
Staphylococcus aureus and group A streptococcus bacteria are the main culprits. They can get in through breaks in the skin or even without breaks sometimes.
Wow. How contagious is it?
Very contagious. Direct contact with the sores or sharing things spreads it easily.
How long is someone contagious?
Without treatment, weeks. With treatment, it's contagious until the rash is gone, the scabs fall off, and you've taken antibiotics for at least 2 days.
Okay, what are the treatment options?
Possible mupirocin ointment or oral antibiotics like cephalosporins or clindamycin.
Can you treat impetigo at home?
You usually need a prescription for antibiotics. Over-the-counter creams might help with really minor, small infections.
What can you do to prevent it?
Good hygiene, washing your hands, keeping wounds clean, and not scratching are all really important.
What are some possible complications?
Rarely you can get glomerulonephritis, a kidney disease with strep impetigo, or the infection might spread deeper or to other parts of the body.
What's the usual outcome?
With treatment, most kids get better completely without scars. It can come back, though, especially in kids.
How long does it usually take to recover?
With treatment, a child is usually not contagious after 48 hours, but the sores might take longer to heal completely.
How can you tell impetigo from cold sores?
Cold sores are caused by the herpes virus. Impetigo is bacterial. Cold sores are usually smaller blisters around the mouth. Impetigo blisters can be bigger and appear in different places.
And how is it different from eczema?
Eczema is a type of dermatitis, not an infection. Eczema blisters have clear or straw-colored fluid, not the honey-colored crusts of impetigo.
Can stress cause impetigo?
No, but it can weaken your immune system, making you more likely to get an infection.
How long can the bacteria live on surfaces?
Weeks or even months on dry surfaces. It's pretty resilient.
What about going back to school or work?
Kids should stay home for 48 hours after starting antibiotics. Adults should cover their sores and avoid close contact.
You mentioned topical and oral antibiotics. When is one better than the other?
Topical antibiotics are good for small, localized infections. Oral antibiotics are used for larger areas or widespread infections.
Is there one type of antibiotic that's always recommended?
It depends on the bacteria. Mupirocin is often used topically. For pills, cephalosporins and clindamycin are common choices.
What about over-the-counter stuff? Is that ever enough?
Only for very minor, tiny infections. You usually need a prescription for proper treatment.
Besides hygiene, are there other ways to prevent it?
Cleaning and covering any wounds right away helps prevent bacteria from getting in. Keeping your nails trimmed reduces the risk of scratching and spreading it.
Any advice for parents?
Teach kids good hygiene. Keep an eye on them to stop them from scratching. And see a doctor right away if they get sores.
Any final thoughts on managing and preventing impetigo?
Early diagnosis and treatment are key to preventing complications and spread. Good hygiene and wound care are really important, and remember, it's highly contagious.
Thanks so much for this helpful discussion.